whoever's coming from outside our area, that's a very small percentage. And I think it's more important to have the clinic open and being able to get a lot of people through it rather than worrying about, a small handful of people that might be coming in from outside the area.
It's not just those of us who live here in Lubbock getting vaccinated against COVID-19, but some people from out of state and even the country coming in to get a vaccine. Good evening, I'm Lauren Motter.
I'm Brian Mudd. Our health departments work for months to vaccinate every eligible person they can, but our public health director telling us tonight a handful of those folks weren't from Lubbock, some from out of state, others from out of the country, and KAMC's Laura Laughead joins us tonight with the latest on our vaccine rollout.
Brian and Lauren, the vast majority of those vaccinated are from right here in the South Plains. But the health department telling us tonight about 50 of those weren't from Texas at all, and some were as far away as Mexico.
There have been travelers from all over that have come into the clinic. The clinic is set up and designed for the South Plains.
The health department saying several dozen people from outside Texas have received vaccine shots at the Civic Center. Public Health Director Catherine Wells says most of them were from nearby states like New Mexico, Colorado, and Oklahoma, but a handful were from Mexico.
The guidance I received from the state said that the clinic's for Texans, but we're not allowed to check for residency.
Wells emphasizes this percentage is very small, and their priority is folks across Lubbock and the South Plains.
We're not encouraging individuals to come here. They should really be seeking vaccine in the vaccine sites that are set up for their counties or their states.
And of the tens of thousands of shots they've given out, not a single one has gone to waste for not having someone ready to roll up a sleeve.
We have never had to throw away vaccine because we didn't have people to give it to. We've only lost about 3 vaccines, and those were times when either it fell on the ground or the needle broke.
In the case of no-shows for appointments, the health department administers those extra shots at the end of the day to eligible volunteers at the clinic or to people who don't meet the requirements waiting in line based on their ages.
Sometimes there are people that show up at the end of the clinic looking, and sometimes they luck out and other times not so much.
Now, as for the Johnson & Johnson vaccines, our health department hasn't received any yet, but they've put in an order for them. They hope to get some at the end of March.